So welcome back to another edition of the Heart to Heart podcast. And my guest today is Dr. Azadeh Khatibi. I really hope I said that right. I even practiced it before. So I want to chat with you for so many different reasons. But, considering your background, that's the biggest reason why, I wanted to chat with you. I know that you've been outspoken against COVID. And it's ironic how someone like you with your credentials, are being, censored right now. So, before I get into and ask you some questions, can you just kind of give the audience a little bit of a brief background about yourself and about all of your credentials?
Sure. Thanks, Dr. Mike Hart, for having me on your show. I'm really excited to be here. So my background is I went to medical school because I really wanted to go to work every day and help people. Very idealistic values. And I went to UCSF, one of the top medical schools in the nation. I got into a 5-year medical program that accepted only 12 people a year. The goal was to train humanistic physician leaders. And at the same time, I decided to also, since I was part of the program, was at UC Berkeley, I decided to get my master's degree in public health from UC Berkeley, because I was already at that time noticing that I was more than just interested in more than just the individual health, but to apply these principles and to understand public health principles and learn them to help people on a larger scale. And so I got my master's in public health, my MPH from UC Berkeley. And then I also got another master's in health and medical sciences from UC Berkeley as well. After that, I did an internal medicine internship at a level 1 trauma hospital. And after that, I went on to ophthalmology residency at UC Irvine, where I was chief resident. And I completed a vitreoretinal fellowship at UC San Diego. So I traveled up and down California to get my training, and I settled in Los Angeles and started practicing. And over the past 7 years now, I've been looking at doing a lot more inner work and strengthening myself and getting more aligned in mind, body, spirit, to then become, I think, more centered within myself to be able to advocate for what I really believe in. And here we are now.
Okay. Well, there's quite a lot to unpack there, but, again, like you have a master's in, public health. You're also an MD. For people who don't, know as well, ophthalmology residency is generally extremely competitive to get into. Like, so, again, like part of the reason why I wanted to chat with you is because it seems like with all your credentials, you should almost be like one of the go-to people to speak to, about COVID. It's kind of ironic. And I had an ethics professor on here probably a year or so ago, Dr. Julie Pinessi. And again, she was, shunned and was eventually fired from or terminated from her position in Western University. Because she had spoken out against COVID. And, it's ironic again in her position because she was in fact an ethics professor. And, she was, talking about how, some of the things that they're doing are unethical. So, do you feel that, it's kind of strange that someone of your stature with your credentials is now kind of being silenced when in fact, it seems like you would be like literally, one of the first people that we should be speaking to about all this, considering the background that you have?
Well, I find it heartbreaking more than anything else. I mean, from a personal level, it just leaves me brokenhearted that we as a society can't come together and in a mindful, centered way talk about our different perspectives and listen mindfully, respond wisely instead of reactively, and to be humble about what we don't know and what we know as individuals and as a collective. So mostly what I've seen this past 2 years has left me brokenhearted because I truly inside really wished for a greater sense of community within the medical field, within government, and within our society. Of course, we're not there. I try to do my best to kind of get there. And so I, I see what I've seen in terms of what the United States government and the information is now coming out has done to be so myopically focused on one narrative, one agenda, and not listening to other highly, exceptionally educated people who are maybe outside of that silo, but are still in the academic world, in the medical world, and want to contribute and are saying things. That myopic focus of government, like that to me is that's frightening, right? Because it has long-term consequences for all of us. And then on a more social community level, just even like as I've gone on Twitter more recently, because I was like off a lot of social media or Twitter really, and once I came onto it, I realized like the level of reactivity that people had, and that of course keeps us back too. So that's kind of what I lead with, and so I try to advocate for that as much as possible and use my brain and try to stay humble, but use my brain and my training to talk about what I believe in. And at this point, it's focusing on medical ethics and free speech so that we can have an open forum so people and doctors aren't afraid to speak out.
Yeah, I think it's been terrible that so many doctors have been muzzled and so many doctors are afraid to speak out because we're not hearing everyone's opinion. We're just hearing the opinion of the physicians and the scientists that are kind of just going along with the mainstream narrative, and there's very few physicians like yourself speaking out. So I certainly do appreciate you speaking out and your voice. And when you went through your education, particularly through public health, like did you ever come across something like this that would have prepared you for this, or were you ever sort of like warned in the process that if something like COVID does happen, it's unlikely that we're going to be chatting with someone like yourself, and that really in reality as someone who has studied public health, you're more or less not going to be able to use all of your skills, and you're going to have to go along with like the mainstream narrative? Or was it more like you thought that if you did a master's degree in public health that you'd actually be able to have more of a say than what you do now?
Well, in our public health training, we studied the principles. We had case studies that we studied of certain public health interventions and why they worked or why they didn't work and how they could be improved. I was in an interdisciplinary program, and we got to interact more with the media and the government and nonprofit organizations, which was fantastic because I got to see in public health training how the different forces interact and sometimes have very dysfunctional relationships. But maybe some people could have predicted the lack of dysfunction in society as a result of seeing the lack of dysfunction here in this COVID time. But the scale of this, of course, we weren't prepared for to really see. And I think that's evident in the leadership, right? A wise leader in government, in the public health institutions of our country needs to stay humble, needs to stay open, needs to know that they don't know everything, and needs to have excellent communication skills and excellent conflict resolution skills. And we didn't see that in our leadership.
Yeah, and I think it kind of seems similar to what's kind of always happened, I think, in politics. I think a lot of people get into politics. I mean, some people get in for the wrong reasons, but I think some people do get in for the right reasons, and they think that if they can get in, then they can kind of change things from the inside. And I'm just kind of wondering, like, did you kind of think by being an MD and by having all these credentials, again particularly in public health, did you ever think that you would be able then to get inside and kind of be able to change the system? But now, knowing that what's happened and how muzzled you've been, that it's kind of been a little bit of a disappointment and something that maybe people in public health don't have as much of a say as they thought they would when they kind of took the job.
Well, I mean, it depends on what path in life you take, right? So there's people who go into practice and they want to see patients all day, or that's the path they've chosen at least, and they don't really have time to be advocates in the public health realm or to speak out. That's the path they chose. And then so when they do speak out, of course they're going to have less of a say, or because they're just not involved in those institutions. Now someone who's gone into that path of being in academics, for example, and chairing a committee or chairing a department and being on top of, or being the head of an academy, let's say the American Academy of Pediatrics or whatever, and has pharma connections, like that person, just because of the path they chose, has so much more influence, right? Because they're kind of at the top of their organization, of multiple organizations now, and they're promoting their agenda, and it's going to trickle down to the rest. So, part of it is like, well, what decisions did you make for your sphere of influence, and to get ahead in the way you wanted to get ahead, and that's going to have consequences. So part of, I think, how things manifested is that there are some people who chose certain pathways that gave them a lot more clout and influence, and that's kind of what we're seeing. As for me personally, though, I think that I had to learn, and this is what I alluded to, in that like the past 7 years I've really been working on myself, really coming at things from not a place of not being a victim. Like, okay, well, this is where I am. Vandana Shiva talks about this beautifully. She says, the earthworm doesn't say, oh my God, I have to like chew through the whole dirt on all of this earth. How can I ever do that by myself, right? The earthworm is just like, this is my space. This is the sphere of influence I have. I'm just going to chew through the dirt here to revitalize it, or for it to live, actually. So, I really had to work on saying, okay, I'm not a victim, and get out of that victim mentality. And it's a process, right? You keep going back to it. And what can I do in my sphere of influence? How can I speak out? What can I do that's in my power to affect change in the way I want? That's all we can, any of us do.
Yeah, no, I fully agree with you on that, and a good follow-up I think to that is, you're talking about how you were censored, and then the bill is AB 2098. So can you explain to us like what that bill is and why you're so passionate about it?
Sure. So as I started seeing at the beginning of this COVID time, that certain voices were being, like you said, the censorship, certain voices were being amplified and certain voices were being reduced. And I think, for example, I have some shadow banning happening on my Instagram account, for example, or on my Facebook account because of what I've posted. That to me, as you said, like being a doctor, MD, MPH, MS, like, I'm like, if they ban me, then what's going on in society? That's frightening. So I started seeing this. A colleague of mine and I wrote a letter to the New England Journal of Medicine, and we thought, okay, this is a compelling letter. We're, with evidence, citing our references about what we were concerned about with the way the public health messaging was at the start of the pandemic, and it didn't, like, there was nothing. The letter didn't get accepted. We were just like, this is strange. Like, there's no way to get our voices out into the academic spheres like we wanted to. And I started seeing that there were other doctors who were getting major backlash, and they were getting censored, and it was like I was suspecting now collusion between the government and social media institutions to dampen certain voices and promote certain narratives. And then I started seeing that a lot of my friends were messaging me, or some of my friends were messaging me, and they were like hinting at the lack of, and these are colleagues, physician colleagues, hinting at the way things are going is like dangerous, and there's a censorship that's happening and the self-censoring that's happening within themselves. So a lot of my doctors my age are now working for, in the US, like, you work for institutions, like corporate type entities. And if you don't toe the line, they're going to fire you. If you start speaking out, like, you're going to stand out like a sore thumb. So in order to keep their jobs, they start becoming silent. So I saw this self-censorship happening among my colleagues. Privately, they were telling me, this has gotten ridiculous. It's out of hand. I can't really say what I want to say. I just went to a dinner party this past weekend where one of the doctors was like, just don't say anything. It was it was the three of us, three doctors and their families. And one of the guys was like, don't say anything, that's like, you're going to stand out. And so like, there's a fear there. It's pervasive and people don't talk about it. And it's dangerous when it's in the patient doctor relationship and your doctor doesn't feel like he can tell you anything. So my friend told me that he tells his patients, I'd love to tell you my opinion, but I can't. Like, who wants to
Wow.
go to a doctor who says, I'd love to tell you my opinion, but I can't. I'm not allowed to. Like, that's frightening. That's
That
that's
is
dystopia.
crazy.
That's
What if
dystopia.
what percentage of your colleagues would you say are not speaking out but would like to speak out? I know
I
it's
mean,
hard to put a number on that, but
it's hard to put a number. Anything I say is not going to be scientific, but so I can't really say, but it's a
yeah.
significant number, and it's more and more. Like, people I didn't imagine are frightened. So I would say at least, like, in my estimate, among my colleagues, probably 60-70% of people are not really saying what they want to say. I know a friend of mine who's an OBGYN, she's concerned about certain COVID interventions in her patients before they do fertility treatments, but she like gives them a sheet. It's like, I can't say anything, here's a sheet,
Yeah.
but it's ridiculous. And so
Yeah.
that's when I saw this. And then when I saw this law from California's legislature, Evan Lowe in the California legislature proposed this bill to make it illegal to speak out against consensus. So say something that's not consensus, they can take away your license for it. When I saw that, I was like, this is bad. This is harmful. This is the opposite. And so I, in my sphere of control and influence, just decided to speak out. I started speaking out. Again, this is why I went to medical school. I wanted to help people, and I really believed in ethics and that idealistic value of let's do the right thing. And the right thing is to have doctors be able to say what their true medical opinion is.
And getting back to your true medical opinion, because I guess we haven't discussed that yet. Like, what is it about COVID that you feel it has not been addressed or has been addressed poorly? Like, what do you feel are the main things that needed to change? Is it mostly the lockdowns? Do you feel like we've over vaccinated people? Do you feel like there was too much masking? Like, what is it in your opinion that we did incorrectly?
So I'm going to speak to the things that were really concerning for me. When I saw COVID happening, I was one of the first people to mask. I remember masking on an airplane, very like close to the beginning of the year, or maybe like a month later. And I remember the flight attendant looking at me like I was crazy, like, bless your heart, sort of look. And because I was super cautious. And then after a few weeks, I started realizing, oh, this pattern of disease manifestation is going to have a differential based on the person's susceptibility. And that was something in the public health messaging that I didn't see. The public health messaging was treating everybody the same. In public health training, we learned that any intervention, a good intervention, needs to have a multi-pronged approach, right? So I would have loved to see, personally, from the very beginning of this, every negative, there's something positive that you can find from it. This horrible virus that is like, has the potential to hurt people, there's amazing lessons in it too, like from a spiritual point of view or just a mental mindset point of view. How can we as a society get healthier? How can we start moving more? How can we look at our childhood-based traumas and notice that they're being re-triggered in this fear spiral that can then lower your immune system? What about diet? What about stress reduction? What about sleep? What about vitamin D? Like, how about healthy behaviors that we can start having a national messaging about? I would have loved to see that, but we didn't. So this amazing opportunity, we just completely wasted. That to me was heartbreaking.
I agree.
And then with the lockdowns, one of the other things that we learned in public health training is the idea of looking at qualities and dailies. So looking at any intervention or anything that happens to a person and how it affects their quality of life and how it affects, what the intervention, what are the downstream consequences of that? And that was something that I wasn't seeing in the public health messaging early on either. One of my colleagues called me early on and she said, every other patient I'm seeing, I'm referring to behavioral health because of these lockdowns. Like they can't take it. That means half her patients on a daily basis, behavioral health is mental health, for your listeners. Half her patients, she was referring to get mental health care because of the lockdowns. Like, to me, that was ridiculous. Like, we need to look at these long-term consequences and the short-term consequences of the interventions that we're doing to try to, especially now that we were seeing that there was a differential in susceptibility based on age and morbidities that patients had.
Yeah, I think you said a lot of things there that I completely agree with. But the first thing, you mentioned about all the lifestyle choices that people are making these days. And there was an opportunity for, us to say that, this is a virus that, can really hurt people when you're having a poor functioning immune system. It doesn't seem to, hurt people as much, or it's not as deadly for people who have, a proper functioning immune system. Here are just some basic steps to help support your immune system. We don't even necessarily have to get into any crazy supplements or anything like that, outside of vitamin D. Just some very basic things like you said, like getting some sleep. A lot of people do get this virus or get sick when they are run down, when they're not sleeping, when they're overworked. And it's been shown that the less sleep you get, the worse function your immune system is. Even things just like eating sugar, eating ultra processed foods, those can also lower the functioning of your immune system. So I think if we just got like the very basic messaging just about diet, exercise, sleep, vitamin D, not would only that have helped COVID, but it would
Right.
have helped
Yeah.
so many other things as well. Like even like the flu, like, because right now we're in this triple demic, what they're calling it, with like RSV, influenza, and COVID. And again, by bolstering your immune system, by having a good immune system, you would be able to fight off all of these viruses much more effectively. So I think I completely agree with you that it was just a completely wasted opportunity. And then unfortunately with that, you also have the lockdowns that were added. And then the lockdowns actually made it more difficult for people to, do some of those things, particularly, exercise, because, a lot of people, they go to the gym to exercise. That's how they do it. I'm very fortunate enough that I have, some equipment at home so I can exercise at home. I didn't have that actually for most of my life. That's only something I've gotten over the last few years. So, I used to be one of those people where I only worked out at the gym. And again, those habits are very difficult to build. And, people, when they get out of that habit, it's hard for them to get back into that habit. And then the other thing on top of that too is everything just kind of like compounds. So what I mean by that is that if you work out really well, then you're kind of more incentivized to eat really well. Like people don't generally work out and then, go eat McDonald's. Generally speaking, after they work out, they're like, okay, now I'm kind of more motivated to get a protein shake or, eat something healthy, like some grass-fed beef, and then once that happens, you're like, okay, maybe I should get, a good night's sleep. So everything is just compounded. And unfortunately, we kind of completely missed out with that. And then the other thing about the lockdowns is that, I mean, it's coming to light a little bit now, but people kind of acted as if, there was no cons to this, and like, of course, if you close, people up, you're going to have less cases, for a short amount of time. But as soon as, you let people back out, the virus is just going to, circulate again. And it's unfortunate that that's the method that we kind of use, because again, the consequences for young children not being able to go to school, and with the masking, again, like just being able to recognize other people's faces, I think it's very important for a child's development. So there are a lot of cons to lockdowns, and I think that those weren't really discussed, so they certainly weren't well thought out, and they were implemented very, very quickly. So it's really unfortunate that we didn't have more people like yourself, again, with all your credentials in public health, discussing these things. And unfortunately, people like yourself are being muzzled instead. And when we're making these massive decisions that impact everyone's lives, we should be taking all of the, so-called experts opinions into account, and not just the ones that, that the mainstream media is pushing and agrees with. So it's crazy that all this has happened. But I really hope that, people who are listening to this, and just people who, have realized that, by taking better care of your health in general, you are going to be less susceptible to these common viruses.
Absolutely. It's like you can, once you start adopting certain habits, especially usually there's like one thing that really starts getting them like upcycling instead of downcycling, cycling up to better, healthier habits. But I think that ultimately, after my experience these past 2 years, I've just become a lot more fearless about speaking out, and focusing on how do we preserve whatever we have in our health. And one of them was like preserving the patient-doctor relationship, because once I saw California attacking it, and realizing, oh, in the future, if this law, which it's going to go start getting enforced January 1st, if this law is enforced in the way that it's written, then we cannot rely on our doctors to give us their true medical opinion. So the law is AB 2098. If AB 2098, once it gets into law, then you can't base your opinions on scientific evidence or the quality of the evidence and your knowledge and your experience and tailoring it to your individual patient. You just have to toe the government line and keep your mouth shut. That's dangerous, and that's why we decided to sue. And so we've got a hearing in January, and I want people to realize that we need to preserve the ability for doctors to give differing opinions from each other, because that's how it works in a free society. And this law is an assault on medicine, and it's not just this law. We have to protect, and this is what I'm working to protect, an assault on autonomy, an assault on free speech, an assault on medicine. This law should have never been signed, and it's unconstitutional. But no matter what the courts decide, I'm going to keep fighting for sanity and the sacredness of the human body and the people who want to preserve it. And that, if we want to really do that, it requires back and forth, give and take between different experts. You go to a medical conference, it's discussion. It's, I do it this way. Well, I think you're wrong. I do it this way. Well, I think you're wrong. And that's how we grow. That's how we learn. Like, if we just want one way of thinking, we're never going to expand and grow beyond, and science won't progress.
Yeah, I completely agree. And that's why too, I try to have on, different opinions on my podcast. Like I've had on Kevin Bass before. He's like hardcore, you gotta lower your LDL, you have to do it. It's absolutely the key to longevity. And then I had on, Ivor Cummins recently, and he certainly doesn't have that opinion. He's not a big fan of lowering LDL overall. He likes to look at other markers. I think ApoB is the big one he likes to look at, and ApoB is a very, very important blood marker for cardiovascular disease. But getting back to your point though, I think that we're discussing so far, this mostly in the context of COVID, meaning that we should have different opinions on COVID, but we also should have different opinions on other things in medicine. And again, COVID is while it has killed a lot of people, it's nowhere near something like compared to heart disease or cancer in terms of total deaths and annual deaths per year. Heart disease and cancer kill far, far, far more people. And so it's very important for us to also have a discussion about heart disease, like I was just talking about, with having different people and different opinions on that as well. So like this, what we're talking about today, yes, it's very, very important in the context of COVID, but it's also very important just in the context of medicine in general. We don't want to just have one opinion on COVID. We also don't want to have just one opinion on heart disease or one opinion on cancer, because if we go down that rabbit hole, then we're all going to be thinking the same thing. We're all going to be doing the same treatments. We're not going to evolve, and unfortunately, then the patients are going to suffer, because you do need to have different opinions. You need to have people challenging each other. You need to have
Yes.
people trying new different therapies, and obviously what works for one person doesn't work for another. And it seems like what they're trying to do, particularly with COVID, but this can extend into other areas of medicine too, is they're just trying to treat every person with like a one size fits all approach. And I think that's the wrong approach overall. And there's excellent examples of this already, and I've brought this up even in a post yesterday regarding the COVID vaccine. Like, assessing the risk benefit does not make you anti-vax. And if you look at something like the shingles vaccine, like, we only give that to people who are 50 years or older, because we've deemed that this is the age group who would most benefit, and maybe in this age group the benefits of the vaccine outweigh the risks. And I think we probably could have applied that to COVID as well. Again, I'm not saying definitely, but it does seem to be like more people, or sorry, certain groups of people are much more susceptible to severe disease and dying than others. Treating an 80-year-old who has a poor functioning immune system and is not in good health, as someone who's a 20-year-old male or female who is in great health, doesn't seem like the right approach. And I think that with that bill that's been put forth, it seems like that's what they're sort of trying to do, is to put everyone in this one size fits all approach. And I think that's very dangerous for medicine. It's going to have bad consequences in the future.
Absolutely. And it's not going to stop here, Mike. It's going to keep going. So this is just and this is the problem with having a large, powerful administrative state, is that they will try to then work with legislature, work with executive branch to just kind of promote more and more control over what we can and cannot say in medicine. So this is just one, like, the tip of the iceberg for what can be. And that's why it's so dangerous. I think what you were talking about with preventing heart disease, I mean, and how that's such a huge problem. If we had done the interventions for COVID that you and I were talking about, reducing stress, and that is also promoting social interaction, healthier families, healthy interactions, excellent sleep, exercise, fantastic vital diet.
Yeah.
I mean, talk about intervening on heart disease. That would have been amazing as well, right? Like, so these interventions could have had so much more downstream consequences on reducing mortality and morbidity for other health problems as well. It's a tremendous missed opportunity, and I'm just boggled by why public health messaging isn't understanding the idea of transmuting negative to positive.
Yeah, like I got to harp on the vitamin D there just for a little bit, just because I've posted about vitamin D so much. And
Such a big fan. Yeah.
and I say to people, even if I'm wrong, like, I haven't given anybody harmful advice. All I'm telling you to do is optimize your vitamin D levels, which would be good for so many different things. Low vitamin D is linked to depression. Low vitamin D is linked with low testosterone. Low vitamin D is linked to osteoporosis, obviously. There's so many things that low vitamin D is linked to that, it's a no-brainer not to optimize it anyway. And, there's been several meta-analysis and several randomized controlled trials now that have shown that, intervening with vitamin D can be protective against COVID. So, there is some pretty high quality evidence. Again, I remember I did a search maybe about a month or two ago, and like the last 3 to 4 meta-analysis on vitamin D all indicated that there was, a signal of benefit. And some of those did include randomized controlled trials as well. So, there is a paucity of evidence that suggests that it absolutely works. And again, even if it doesn't, it's still going to be so beneficial for your health for so many different reasons. So, not, telling people or advising people or recommending them to take vitamin D, especially during lockdowns and when we're, locked up here in Canada in winter with no sun. I mean,
Wow.
people are going to experience extremely low vitamin D. So, that I think would have been a fantastic intervention that probably would have, saved a lot of people. And it's unfortunate that that messaging, was not put out there.
Oh my gosh. Add that to the list. I always try, I made sure at the very beginning or pretty soon into that our vitamin D's were optimized.
Yeah.
On the
It's
higher side
critically
of
important.
normal.
Yeah, I always, the vitamin D council has a recommendation of 1,000 IU's per 25 pounds of body weight. I tell the people to take at least 500 IU's per 25 pounds of body weight. Get yourself tested, and then if your levels are good, great. But if they're not, maybe bump them up a bit. Because whenever I test people, and I'm sure you probably see the same thing too, is that people are generally very, very low. And especially here in Canada, especially during the winter months like now. So it is critically important for people to correct that. And unfortunately too, a lot of the recommendations are very low. Like people always say to me, I'm taking 1,000 IU's a day or even 2,000 IU's a day, and I test them and they're still low. So, and I can't be the only doctor, getting these results with these patients. So, I think that overall the recommendations are too low. And I understand, starting low and going slow because it is a fat soluble vitamin. So, you do have to be careful. But, I think that we could be a little bit more aggressive on the recommendations, and definitely could be a little bit more aggressive on getting people to test the vitamin D levels like they would, test their kidneys or their liver or anything else.
I remember, oh gosh, it's like 10 years ago, I was talking to a primary care doctor and I said, or maybe this was in training. I said, this patient's primary vitamin D levels low. Look, tested low. And I think it was in training, and the attending looked at me and said, oh, everybody's low. It's like it's something. And I was thinking to myself, okay, well, everybody's low. That's a problem. That's not like, oh, everybody's low, we ignore it, right? It's like,
Yeah.
I was like
Like saying
boggled.
everyone's obese, let's like ignore it. It's like,
Yeah, exactly.
okay, just because, and I mean, the stats in the States are crazy, but they're getting higher in Canada now. But in the States, it's 42% of people are now obese and over 70% are overweight. So
Wow.
and again, I'm not fat shaming here. I'm very much against,
No, you're
fat
naming
shaming.
a fact. You're not shaming. I think
Yeah.
anybody who thinks that that's shaming is bringing their own issues to the table. You're stating facts, but please continue. Yeah.
Yeah, because I have seen and understand that there's evidence that fat shaming can in fact make obesity worse, but it needs to be discussed, and we need to stop normalizing it or glorifying it. Like there's when people say like fat positive or obesity positive, it's like I understand what you're trying to do, I understand the messaging, but there's really nothing positive about that. There's nothing really positive about obesity. It's detrimental to your overall health. I mean, if it's not affecting your self-esteem as much as others, that's fantastic. There's no need to add suffering on top of it, but it certainly is not positive for your health. It's definitely negative. And doing anything to be able to reduce your weight to get into a healthier BMI would be helpful in the long term. But I didn't really, sorry, go ahead there, as I think
No, I'm hearing what you're saying, and the thought that comes to my mind is that we really need a reframing of how to think about health and where we are. So, to be able to be loving of ourselves and to love ourselves no matter what our physical situation, whatever we look like, whatever, however large our nose is, or our breasts are, or our stomach is, or our muscles are, or calves are, wherever we are, to be in complete love with ourselves, and to only speak loving thoughts to ourselves, right? That's like, and to honor ourselves for where we are, and at the same time say, this is where I am, this is where I want to be, or this is where I can be even more vital, where I can move and can have strength and I can have flexibility to navigate this physical world in which I live, and to love myself here, but also like be like, this is a better place to be for me, because I'm going to be physically strong. I can go long distances. I can take it, and as I get older and older, I'll be able to be vital for even longer. and I'll be a senior citizen who's going to be strong. Like, and yeah, maybe I'm not exactly where I want to be, but that's cool. I love myself, and let's get stronger. That's kind of, I think, the shift that we need to make, so that we can say, okay, someone's like morbidly obese. They're beautiful as a human being, and they should love themselves and speak lovingly to their body. And at the same time, let's get out there and start walking, because we got to get somewhere else. That's kind of how I frame it in my mind for the things that I, where I am now, how I love myself, and then where I want to be, and to take the steps to get there.
And how did you kind of get to the place that you are at now? Because it's, again, like I had a gentleman, Dr. Brian Goldman, on earlier this year, and like he said, a lot of our older colleagues, older doctors, they get very bitter when they're older. They're kind of like angry, I guess, a little bit jaded, and sometimes can be short with their patience in many ways. And I'm still, I guess, not new. I'm almost going into my 10th year now, so I haven't hit that stage yet in my life. But I certainly do understand what he's talking about when he's talking about those colleagues. So like, how have you kind of just maintained this this vibrancy that you have, and been able to just kind of still be so positive, even though you're seeing people just deteriorate in their health all the time? How have you been able to kind of manage that and keep your spirit so high?
Well, I think there's two things that I want to address here. The first one is, the second one's my personal story, but first I want to talk about like the idea of burnout and
Sure.
mindset. So I think when we're younger, the idea is that we have fluid intelligence, so we can go, and kind of be totally focused on what we want and spend hours at it and be cool. But then as you get older, like in your 40s, late 40s, 50s, the brain starts becoming more crystallized intelligence. And that is more like summing up all of your experiences in life. And you don't have as much stamina or even desire to be that go person, but it's like the transition to a new stage in your life as a wise elder, right? And I think a lot of people don't realize that change, and that we have different stages in our life, so that like that old curmudgeonly person probably hasn't actualized the true manifestation of the potential that they have within themselves at that stage in their life. They're still doing the same thing. And then there's mindset work involved in it too. Like if you're burned out, you're going to be, in a closed off situation, and you're going to be reactive, and you're going to be negative. And that is all, of course, linked to the larger picture of our medical systems, or just our systems in general, and like how toxic and egotistically based and excessively hierarchical they are, and how we don't really live in true supportive communities in our families or in our community or in our workplaces. And then for myself, like I said, I was on a journey more these 7 years. 7 years ago, I got a very serious illness. It changed my life, where I had to like stop everything and evaluate the totality of how I was living up to that point. And I was like, I'm such a good person. I've always tried to do good things, like, and be a good person. And I've sacrificed so much. Like, why God, why did this happen to me?
And what
And
was it that you were infected with? Okay.
maybe I'll tell you guys about it some other time.
Okay.
But it was severe. It was horrible. It made me literally stop in my tracks. And it has long-term consequences. But some of the good long-term consequences was that I ended up going to therapy. I ended up studying mindfulness, meditating, getting on an exercise programming, healing my childhood, or starting the work of healing the childhood traumas. Like I grew up in a war zone in Iran, right? Like, and understanding, then going back and studying the research on adverse childhood events, understanding the science of highly sensitive personalities, and how 15-20% of the population who are highly sensitive actually have 50% of the physical and mental health diagnoses that are made in the United States. And realizing that these people carry such a high disease burden. and the idea of allostatic stress on the system, and then studying some more Eastern philosophies and seeing how the Western and Eastern paradigms actually integrated. And research is showing, of course, more and more that these things are actually like a lot of the Eastern knowledge, or some of the Eastern knowledge, they're actually being proven in science now, right? Like 20 years ago, somebody would say acupuncture, ha, so they'd scoff at it. Now insurance companies pay for acupuncture. It's really interesting. But really studying that, really looking now at health in a completely different way than I was taught, and looking at health as an alignment, true vitality in health as an alignment of the physical, the mental, emotional, and the spiritual. And when you're off that alignment, then disease manifests. So, I mean, I saw that within myself, and my daily practice, involves a meditation, involves the journaling, connecting to nature, really connecting to my true self as a source of, as part of the source, but also as a loving being, and doing everything towards myself, trying to do everything to myself for myself and to others to try to manifest that love. It's a journey, but I've dramatically changed my mindset from a fixed mindset to more of a growth mindset. I focus on loving kindness and getting rid of all the subconscious baggage. And it's a journey. The more you uncover, there's more to uncover. But I've dramatically changed my relationships with the people who came before me, the previous generations, my parents, my children, I feel are on a different trajectory as a result of this. And it just keeps getting better and better. I mean, look, now I'm suing the state. Like, I would have never thought I'd have the power or the security within the self to be able to do that. But the more you focus on that small plot, as the worm does, on that small plot in your own circle of influence, it's going to grow and it's going to grow. And it's all about feeding the physical, feeding the mental, emotional, and feeding that spiritual.
Yeah, I think that was beautifully said. And obviously, you do a lot to take care of yourself.
Yeah.
And I think that, a, taking care of yourself physically will go, a long ways, but you're taking care of yourself, mentally and spiritually as well. Like, I certainly exercise pretty much every day. Sometimes I'll take like 1 or 2 days off a month, but for the most part, it's more like 7 days and 6 days a week.
Wow.
And then, I eat very well, and that certainly has played a big part in my life. And part of the reason too why I'm I've never actually I missed 1/2 day of work for being sick, like, ever since I've started, so in almost 10 years.
Wow.
But beyond that though too, I do a lot of reading. I talk a lot about Stoic philosophy. I read a lot of Stoic philosophy books. There's the daily Stoic journal I generally read every day. There's a 5-minute journal. I've gone through maybe 10 or 12 of those. There's other things I find I get a lot out of listening to music as well. Some people don't, for whatever reason. I find it strange when people don't have a new artist that they're listening to, or someone that they're always kind of listening to. I'm kind of obsessed with music that way. So there's other things that I do in my life that beyond like the physical, that certainly help me out mentally. And I think that that's missing from a lot of people, and particularly from physicians as well. Not to kind of pick on, and maybe not more than the average person. Everyone, I think, is kind of lacking these things. But we talk a lot about the physical, and when I say physical, I guess I'm mostly referring to nutrition and exercise. And I should have mentioned in there too, I mean, sleep is so important. I mean, I would even say it's even more important than nutrition and exercise. And again, I'm someone who is insane about their nutrition. I'm very, very detailed oriented, not like obsessive compulsive, in my opinion anyway. Some people may call me that way, but but I still think that sleep is the absolute pillar of health. That's what
really
you should fix first, because if I've chatted about this before. There's studies that show that if you don't sleep, you actually consume more calories the next day. And it's just because, like, when you don't sleep, what you want to do is you want to change your physiology. You just don't want to feel the way that you feel at that moment. So, you grab the caffeine. Again, I'm not against caffeine. I have, caffeine every day, but just in a moderate amount. And actually one thing that I've changed about that recently, and I got this from Andrew Huberman, is I am now delaying my caffeine for at least an hour in the morning.
Yeah. Yeah.
Today I did 90 minutes. That might have been a little bit of a stretch, but I think that does make a difference. Then one thing I'm doing now too is like as soon as I get up, within like 2 minutes, I got the bright lights on me just to make sure that my circadian rhythm is optimized. So I think that we do focus. I'm not saying too much, because obviously we're failing physically too, because we're chatting about the obesity stats earlier. But in terms of like preventing yourself from burning out, I think that focusing only on the physical isn't enough. It's definitely part of the equation. I definitely sometimes need to come home and just lift some heavy weights or hit the bag. I do quite a bit of MMA, so I need to do those
Wow.
things, but I also, need to sleep. I need to do the sauna. I need to do the journaling. I need to read books, and again, books that I find, uplifting, or something that can, teach me something, like the Stoic philosophy books that I was kind of discussing. So, there's more to it than just one thing. It's gotta, you gotta encompass everything. But I'm so sorry to do this, but we are running out of time there now. So I would love to have you back on the show, because I'd love to chat more about the things we were just chatting about, as opposed to say
Absolutely.
COVID. But can you tell people where they can find you online, your Twitter handle, your IG handle, all that kind of stuff?
Sure. Thank you so much. On Instagram, you can find me at Dr. Azadeh Khatibi. And on Twitter, I'm at Azadeh Khatibi. So my name is spelled Azadeh, last name Khatibi. Dr. Azadeh Khatibi and Azadeh Khatibi. This was so great, Dr. Hart. I loved it.
Well, I thought you were an amazing guest. Again, there's lots of topics that we covered today that I wasn't, didn't really anticipate covering. And, now that we've spoken, I do want to, speak to you more about kind of this like spiritual journey that you've gone on, and what you're doing to take care of yourself, and also to maybe, give some helpful hints to, our colleagues. And we're certainly not saying that, two of us have all the answers, but maybe we can provide, some help to some people who, do feel burnt out in a profession that does experience a high rate of burnout. So, I think that
Yeah,
would be
I
helpful.
mean, yeah, what we're talking about today on these topics is actually connected to the greater whole. I mean, it is connected to the lawsuit. This is all, for me, it's an interconnected, beautiful web. And yeah, these small conversations that we have, because we have free speech, we get to create sparks for other people. It's beautiful. Thank
Yeah,
you.
I love doing it, and I love this conversation. So everyone, thanks so much for listening. And as always, I'll be back again next week.
Take care, everybody. Bye.